You're watching and listening to VABC Association News, corporately located in Arizona and trademarked internationally.
If you assume every hospital, or long-term care facility, or rehabilitation facility and their staff members who are placing PICC lines, midlines, and peripheral lines are equally qualified, think again. When it comes to your veins and your complete healthcare management, who's holding the needle matters. When you or a loved one needs a PICC line, midline, or even a standard IV, it's more than just a routine poke. The person placing that line needs proper training, specialized skills, and, most importantly, the right license. Here's what you need to know. The VABC Association, a leading authority in vascular access and patients' right to know, specifically advocates for the safe placement of vascular access lines and devices by licensed doctors and licensed nurses only with advanced certified vascular access training to perform these procedures. Now, with regards to respiratory therapists placing vascular access devices, unfortunately, after sending several letters to both the local and national respiratory examining boards on vascular access ethics and vascular access licensing procedures and hearing nothing in return, and after researching and going undercover to provide our own assessment and evaluation of line placements by respiratory therapists, the VABC Association does not advocate for respiratory therapists to place vascular access lines due to what we feel was inadequate training, inadequate licensing requirements, especially for comprehensive care patients with high comorbidities. And after continuing our investigations into the lack of professional management and potential manipulation with respiratory boards to push license boundaries in Arizona and other states, without a transparent full disclosure, with clear, legal, spelled-out processes that we can trust and that patients can trust, the VABC Association does not advocate vascular access lines placed by respiratory therapists, and VABC Association definitely does not advocate anyone with a generic vascular access specialist badge. In their investigation, they found healthcare facilities having staff members wear vascular access specialist badges who were not qualified to place vascular access devices. So why is all this important? Because the way to win in healthcare is through transparency, and because cutting corners on credentials can mean higher risks, complications, infections, long-term harm, and potential death. Some hospitals might let respiratory therapists place lines to save money, but the VABC Association says they believe it is not in the patient's best interest, despite the push from many administrators to save on labor costs, nor do they believe that it is ethical or legal, without proper and full disclosure to the patient. If a respiratory therapist is about to place your vascular access device, you must be legally informed and you can deny placement. It's your right to know what level license the hospital or long-term care or rehab facility is investing in to provide the best vascular access care for you and who is potentially breaking any laws. And as a patient, you have a right to refuse what you are uncomfortable with and specifically ask for a licensed doctor or a licensed registered nurse that specializes in vascular access to place that line to ensure the best possible outcomes. And if you spot a badge that simply says Vascular Access Specialist, ask questions, demand clarity. Bottom line, your safety is non-negotiable. Always verify the license and credentials of anyone placing a vascular access device. When it comes to your health, only trust the experts who advocate for ethical patient care and patient rights and transparency in hospital and long-term care. If you would like to know more about how the VABC Association is working towards a patient's legal right to know and attain the highest safety standards, and their mission of raising vascular access training, the board exam qualification, and exposing nonprofit fraud in healthcare and more, go to vabcassociation.org. VABC is corporately located in Arizona and internationally trademarked in Australia, Canada, China, European Union, United Kingdom, and the United States of America.